Areola nipple reconstruction is essentially putting pigment into the skin where patients have lost it due to reconstructive problems, complications, surgery. Sometimes they aren't able to keep the nipple, so we are able to kind of go in and recreate one for them. So the restoration process includes us kind of having you guys come in, bringing a significant other if you would like to, if you need that extra support, or even an extra set of eyes. We map things out. I kind of size and place different areolas, nipples. It's all essentially very customizable to the patient. So a good candidate for this service is essentially anyone who's had any type of breast reconstruction, whether that be mastectomy, whether that be a breast reduction, anywhere and anyone that could benefit from pigmentation back into the nipple area. So during the consultation, I have you come in, we kind of show you different samples that we have of past work I've done. We kind of talk about, different colors, your expectations, the healing process, and what it's going to look like essentially the day you come in, so that all questions are answered and we're feeling like we're all on the same page. So I do offer other tattoo-based services. I do a lot of microblading, which umbrella term with micro shading, powder shading, combo stroke, essentially just eyebrow tattooing. And I also do paramedical scar tattooing as well, where we kind of help camouflage hypopigmented scars to kind of become more skin toned and a little less obvious. So results after this, patients can expect to have a little bit, I would say like a weight lifted off their chest. Most of them feel a lot more whole, a lot more complete. A lot of people who said they didn't know if they needed this realized after the fact that they really did, and they're happy that they did it, which is a privilege for me and honor. It's very, very satisfying, very rewarding. Even with, I always like to make sure the longevity of the tattoo holds. I always have you guys come back 4 to 6 weeks, make sure that everything is healed correctly, the color looks great, we're happy with the size, we're happy with placement. If not, we make those changes at that appointment, and we keep making changes until you're happy with your results.